Hey Camp followers, I am hoping that you've returned to hear more from the lovely Dr. Katie Friel-Russell, who is giving up her time to talk about the behavioural aspects of pain, and quite a confusing picture for many owners. So we've already discussed a few common scenarios, such as the dog that loves ball throwing, even though they are carrying quite a lot of discomfort. And then we've also talked about, other aspects of those high intensity games, such as ball throwing in our episode 2. Today, we're going to talk about something that I've seen quite a lot through my 20-year career, which is the dog that arrives and they're quite in your face, and they're quite challenging, and they're quite confrontational, and they come across as very able, and they're very physically very able, and they're not going to let you touch them or pick up your foot or actually go anywhere near them. And you think to yourself, well, how can you physically be in pain? You're coming across as very able. And this can be really hard for owners to understand, because we have preconceptions that if in pain you become less able, and therefore you would be less able to challenge the vet or the therapist or the owner. Explain that for us, Katie.
Well, first of all, we need to be aware of how dogs communicate, because this is a huge chunk of behaviour that is often misinterpreted, especially those leave me alone behaviours that you talked about. So dogs might lunge forward or bark or snap or growl or even try and bite. And for people, we see that as incredibly rude, and that they're referred to as horrible or nasty dogs, whereas actually in dog language, that's saying, please leave me alone, please get away from me. And it's actually really quite polite. Those dogs that spend ages growling and snarling at the vet are having so much self-control. They're saying, look, I'm giving you so much time here, I'm really warning you, please leave me alone. And when we translate that, it doesn't, although the physical ableness, I'll get to that in a minute, but when we translate what they're saying, it doesn't seem quite so crazy when we're thinking about the pain aspect. In fact, it makes a lot more sense. I mean, even as adults, and we've got lots of understanding, how many adults are scared to go to the dentist because of the pain? We can sit there and we can say, oh, I wish this wouldn't happen, but I'm okay and I can sit here. But there are lots of adults that don't. They just don't go to the dentist because they're scared of the pain.
Yeah.
And so for a dog whose understanding is a lot less, they're going, I'm in pain. And I remember last time I came here, they were like wriggling my legs, and it really hurt, and I don't want them to do that again. So I'm going to really tell them to leave me alone.
Yeah.
We also get a huge surge of all those neurochemicals coming on board, potentially some excitement for some dogs in that situation, but for most of them, it's going to be a lot of negative emotions there. And we really go into that fight or flight mode. You have to protect yourself. There's no point doing that whilst looking really weak, because from an evolutionary standpoint, you're not going to last very long. You've really got to show you're a big, strong dog that is saying, do not come near me. And it makes sense from the dog's point of view, but it can be so confusing for owners in particular who see this dog, all those big legs, standing properly proud on all of the legs, jumping up on back legs that they never do at home, and suddenly it looks like all the pain's gone away.
Yeah, and that's really common. And the next part, which is not something that we're going to cover, is even more challenging for the vet. So say the first opinion vet that case has gone to is quite aware that those more confrontational, more repulsive type behaviours are very likely to be linked to pain. They then had the challenge of actually trying to get anywhere near to start looking for where the pain is. That's a completely different kettle of fish.
Oh, so, it's so difficult, yeah.
It's so difficult. And as the vet who's just taken a case by Katie, so say Katie sent me a case, said, look, I really do think pain's underlying this, and we need to go and find out where it is, and investigate it, diagnose it, and then find an appropriate treatment plan. it's really hard work trying to read their body language and their indicators of what's sore and what's not.
Yeah, absolutely. And because especially when these dogs are your large breeds, it's dangerous as well. You know, a
Yeah,
lot of these dogs, when they're really sore, they're going to really keep telling you, and that could result in a bite. And
yeah,
then so people think about putting a muzzle on, but unless that's trained appropriately, so desensitizing them and counter conditioning them to muzzles, that can actually exacerbate their behavior rather than make them any safer. And
yeah.
very quickly you just can't get the muzzle on either, so it can be really challenging.
It can be really challenging, and sadly, I'll be I can stand corrected, but I don't think there is one size that fits all, and I haven't met anybody that has the answer to all of these cases.
Oh no, a long
I
way
think
from it.
a long way from it. And I know for me, as a first opinion vet, it's very challenging trying to meet the expectations of the owner and the needs of the dog. So an owner will come to the clinic and I will have 15 minutes to try and take a history, observe, clinically examine, diagnose, prescribe, and write up notes before the next patient arrives. And the owner is expecting answers and an action plan, and the dog's expecting me to just leave them the hell alone. So it can be really, really hard. And I think, knowing what I know now, I'd encourage practices to almost, accommodate the need for more time, a low stress environment, a familiar face, a comforting environmental kind of like the surfaces, the size of the room, all of that, because there's a lot more of these cases than I think we really admit to ourselves. Do you agree?
Oh, absolutely. So many of the dogs that are using those repulsion, those leave me alone behaviors are completely driven through pain, but they just get written off as that nasty dog. And so nobody, and even owners will say, oh yeah, well, other people, especially the vets, he just really doesn't like them. And we just leave it at that. And
Yeah.
then that dog's left suffering for the whole time, and nobody wins.
Nobody wins. I think it's a good point before we end this audio to just also remind people that, unfortunately, removing the pain doesn't mean that those behaviours become wiped. It's not like a computer disk, not like a hard drive, where once you've removed the virus, everything's going to start working properly again. You have to reload the programs, the clean programs. And I think that's another thing that I've found very challenging through my career is we've started heading in the right direction. The owner's on board, pain has been identified. They're starting to see marginal improvement, but then that's where it stops because the behaviour is learnt and the coping strategy has been successful in the past. So why not use it again?
Yeah, absolutely. And until they're put in that situation, they aren't even sure if the pain is there or not. You know, if the general day-to-day pain is gone, that they don't know that when you next go to manipulate those joints, that extreme pain is going to be there or not, because that manipulation hasn't happened or not. So not only is it the learned behavior, but they don't actually know whether the extreme pain is there or not. Does that make sense?
Absolutely. So just before we end this audio, there's probably going to be a number of people that listen to this who are at their wits' end. They're emotionally broken themselves. They feel challenged that they have a dog of said description and they want to do the best that they can. What kind of advice? I know that we've interviewed Sarah Heath before, and I would feel quite confident to get a behaviourist on board in the plan. What's your kind of advice?
Oh yeah, absolutely. This is where everybody working together, so your GP vet, your owner in particular, and making all those modifications, and your behaviourist to help them along the way, because they need to understand the dog. All these dogs are different, none of them are robots and are going to follow the exact same pattern. And so we need to modify their treatment plan as they progress and personalise it to them. And the only way is to, like you were talking about with the computer analogy, is to reprogram them, teach them that they don't need to be scared of that pain anymore, and therefore the stimulus that created it, in this situation the vet, doesn't need to be scary. But it takes a lot to unlearn that. Even in humans, if you've had an injury, so I am thinking about somebody that's had a broken leg and it's healed and you've been told it's absolutely fine now, most people will then guard that leg for the rest of their life, because they will be worried about it, that it's not quite as strong anymore, or remembering the pain of it, even if it doesn't hurt anymore. And we are much more intelligent than those dogs.
And I think anybody that's ever had a relationship or a family member or a child, we don't expect ourselves to suddenly resolve an issue, a behavioural issue, a psychological issue. You can't say to somebody, right, that problem's fixed, get over it.
And even
it doesn't work.
We don't expect ourselves to be composed when there's pain either. How many times? I mean, my husband, if I've got an earache, he knows about it, and and that, you know, I'm a fully grown adult, that, you know, human, that should be able to manage my behaviour. But when pain's involved, it goes out the window. And then we get frustrated when that happens with our dogs.
And that's the worst thing, is that hopefully these audios are going to open people's eyes, but we also want to give you avenues to try and implement change. So if we have highlighted something to you, you're now sitting there going, oh God, that really rings true, what do I do next? I would suggest that you contact your vet and ask who they would recommend with regards to behaviour, and give that person a ring, have a chat, and see if that's something that you can pursue. So that's it for today. We're going to come back tomorrow. We're going to have another topic. I haven't quite decided yet, so it's going to be a surprise. So we will see you tomorrow.